Hi, my name is Scott. One of the questions I get a lot when I'm introduced to a new patient or a parent of a patient is, what is a functional medicine doctor or practitioner? And so I haven't seen too many explanations out there. It's becoming more well known, but really, where does this person come from, and how do we become functional medicine doctors and practitioners? And why I separate doctors and practitioners is because a doctor goes to school, medical school, he gets his degree. He's got a lot of education on the body, and he's trained primarily to use pharmaceuticals in his tool belt. And whether you're a doctor or you're a doctor of a different discipline or a clinical nutritionist or a naturopath, um, all of us start out at zero when it comes to functional medicine, and we have to go to functional medicine to get certified. I'm a little bit of an anomaly because um, I was kind of thrown into the fire. I started international for a company called Metagenics, and they created the Institute of Functional Medicine. So back in the 90s, I was told that they weren't going to pay for me and a doctor to go over and lecture the doctor. So I had to learn. And I spent hours, days, months, years, so I could become a well-known speaker in 23 countries to doctors because I really was challenged. I was young and I didn't have that MD behind me. But really, the important thing I wanted to emphasize was, what does a functional medicine practitioner do? And what makes one maybe a little bit more advanced than the other, or what are some of the things that they should have, and what are some of the new emerging conditions that are really kind of the top things that we're dealing with that Western medicine really doesn't have an answer? So, functional medicine wants to always look at the root cause. Why is something happening? There was a doctor that was on Mark Hyman's show, and I remember Dr. Hyman from back in the 90s when I was at Metagenics, and he was very looked up to way back then, and he hasn't aged very much either. But brilliant, brilliant man. But he had this Dr. Bretzin on there, and he was a neurologist that became enamored with functional neurology. And I just thought it was really interesting that he said, we are practicing medicine that is a century out of date. He was talking about how we've advanced with cell phones and tech and cars and everything else, but we are practicing medicine, or a lot of the traditional MDs, that's a century old, and we're just treating symptoms. You have a problem and you're given a drug to treat the symptom and not look at the root cause of what's causing that condition. So when we talk about functional medicine, normally a lot of them are using advanced compounds that have scientific studies and discovery and clinical trials behind them, and they're very knowledgeable in that area. But if you look down here over a little bit, right below where it says root causes, um, the emotional part. So a lot of people, especially in my area with brain injuries and stroke victims, and now I'm getting a lot more other mental issues, or patients with other mental health conditions. So I got a degree from the Institute of Integrative Nutrition, or another degree kind of in the psychological component, to be more of a wellness health coach, because a lot of people are going through things when they have these types of conditions. But I really wanted to just kind of explain what a functional medicine practitioner is, and why they look at something. And I want to use autoimmune as an example, and why? Because it is now the third most common disease category after cancer and heart disease. And what's really interesting is that autoimmune, a traditional MD really does not have an answer for an autoimmune condition. Most people, at least when I was back on doing the world tour, um, uh, had gone to 4 or 5 doctors before they found a functional medicine practitioner that could help them with with an autoimmune condition. And now there are over 100 different autoimmune diseases, and my specialty really is becoming in the brain. And when I say brain, I also look at the gut brain as well. But an autoimmune disease is a condition where the body's immune system attacks healthy tissues, organs, and cells by mistake. So why is that happening? And we have, most of us have learned to understand the term leaky gut, or know at least that they've heard of what is a leaky gut. A leaky gut really is we have these tight junctions that are supposed to kind of protect our gastrointestinal barrier. And we're supposed to break down different antigens, molecules, viruses, whatever it may be, into much smaller amounts so that they get only the small amounts can get through these tight junctions. So when these tight junctions start to separate, that's when we get what's called the leaky gut. And these larger particles and antigens have codes on them. And those codes are very similar to codes of different parts of our bodies. So let's say the code, and I'm going to say this in a very simplistic way, is ABC123 in our joints. And the code that gets through is ABG123. And our immune system looks at that and goes, oh, that's a foreign invader. It should have never gotten there because of the leaky gut. And we also have now leaky brains, which is a whole nother topic I'll briefly touch on. But this molecule was so large it shouldn't have gone through. So its code is well displayed, and the immune system sees it and it goes foreign invader, code, attack it. Then it looks around and let's just say, for instance, in this case, we're talking rheumatoid arthritis, and it looks at our joints, and that code is a number or a letter off or a few numbers or letters, but they look very close, and the immune system goes, hey, that's a foreign invader too. And then, wow, boom, you've got an autoimmune disease, and you never get rid of it. So you have to deal with it now the rest of your life because your body has coded it as a foreign invader. And then the problem that's happening is people are getting polyimmune conditions, meaning that they have several autoimmune conditions because they've had a leaky gut for so long. So it's really important that we look at functional medicine now as a new paradigm, a shift in healthcare that's absolutely essential to some of the things that we're facing. So if we were to look at autoimmune or somebody with rheumatoid arthritis, a traditional doctor is going to give them an anti-inflammatory. And then get this, the anti-inflammatories that work the best for inflammation in the joints are like ibuprofen, Aleve, naproxen, those types of things. And guess what? One of their side effects is bleeding of the gut, leaky gut. So you're exacerbating the condition you're trying to treat with the drug that you're using. And in some cases, they may use what would be an immunosuppressive to stop the immune system or bring it way down. So, what would be the difference? What would a functional medicine doctor do with an autoimmune condition? Well, first they're going to do is what is the root cause? These antigens are getting through into the gut that shouldn't get through there. So, seal the gut, seal that gut barrier back up so those antigens can't get through. Then I think it's adequate to say now, because mental health has become such a hot topic because it's become such a prevalent issue for so many people. that we have to look at making sure that the blood-brain barrier is sealed as well as the gut. And then look at anti-inflammatory compounds that are able to reduce inflammation. Curcumin is an amazing anti-inflammatory that is as powerful as non-steroidal anti-inflammatory drugs without causing gastric bleeding or damaging the liver. And in some cases, some of the anti-inflammatory compounds support the liver and they support sealing the gut, quite the opposite of the drug. So, I mean, you can just start to see how just right there, functional medicine can really play a dramatically different role in some of these chronic conditions. And then modulate the immune system instead of suppress it. Everybody that died from COVID died from the cytokine storm, and that was an overreaction of our immune system. And our immune system kind of can do two things. It can throw bombs that explode and get rid of the bad guys, but it does damage to our bodies. Like it's a bomb that goes off and we get damaged. So the cytokine storm, all these bombs went off in COVID and we're killing people. We can modulate the immune system to be more like Navy SEALs, where they go in, they get the bad guy, but they don't do any damage to the house, our body, or anyone else. So very selective. So modulation, not suppression, with the immune system, really is the way to go. And then you want to look at whatever particular part of the body that is affected by this immune autoimmunity and support that in whatever way or uh, whatever part of the body is having a problem. Let's say someone has Hashimoto's and we're dealing with the thyroid. There are a lot of compounds that really can help the conversion of T4 to T3. So besides just Synthroid and putting in synthetics there, we can drive that T4 to T3 conversion, which is really in many cases the problem that's developed. So when you look at this, sealing the gut, sealing the blood-brain barrier, reducing inflammation without causing the side effects or a leaky gut, modulating the immune system and supporting different parts of the body that have a chronic condition, um, that's functional medicine. And this gentleman named Paul Pfizer, um, he said today 95% of prescription drugs are maintenance drugs that treat only the symptoms of a disease and that you're expected to take for the rest of your life. And who is this guy? I looked him up because I thought it was an amazing quote, and it's so true. Not to take away, because there are some fascinating, fabulous medications and drugs that we do have. So please, anyone that you go to that is a functional medicine practitioner and poo-poos Western medicine completely. Stay away from that person because there are some incredible medications out there and there's some other therapies out there. You want someone that wants absolutely the best for the patient, whatever that is. But anyways, the gentleman that said that these drugs, 95% of them just treat symptoms, he was voted the best teacher 5 times in his 21-year career at New York University and has started 6 leading companies with a market capitalization of 1 billion. So just somebody that I think I would kind of trust in what they said, but very true. Many of our drugs today are really just treating symptoms, and functional medicine is doing what that first doctor said, that we're using medicine that's like a century old. We've come so far with cell phones and cars and everything else. But now functional medicine really is something, or integrative medicine, that we need so desperately. And I'll get into why it's even more important today than it was 10, 15, 30 years ago. So when you're looking at the attributes of a good functional medicine practitioner, it's the time and education that they have in functional medicine. So again, Someone can come out of medical school and only have 15 minutes of nutrition. They get a degree or they get a certification in functional medicine in several months, and they're they're knowledgeable and they've got a good foundation. I have 30 years of educating physicians. There's guys out there that have 30, 40, 50 years. There are some doctors, whatever, 20, 30 years, but they've focused really on functional medicine and understanding the root cause of a disease. And I'm going to skip down one to the bottom. I also think they need to be specialists. Just like a functional medicine doctor should specialize in certain areas. My area is the brain, gut brain, primarily stroke brain injuries, but I'm dealing with a lot more mental illness. But just like a doctor, if you have an injury to a knee or your back, you're going to go to an orthopedic specialist. So I think it's becoming more important now when you look at a functional medicine practitioner or doctor that they specialize in certain areas or the area that you have a problem with, and that they are open. They either can prescribe because they are a doctor or they are open to working with a doctor and prescription medications. Again, there are, even though 95% are maintenance and just treat symptoms, there are some fabulous medications and drugs in the world. And then knowledge of the companies, because when you get a pharmaceutical, whether it's a generic or a brand name, it's the exact same thing. But if we just look at something very common, and I don't want to say common, it's probably the wrong word because magnesium, it's a mineral, but most of us are magnesium deficient. And magnesium is responsible for 300 different processes in the body. So it is very important for us to have adequate amounts of magnesium. And there are a lot of people where magnesium can play a really critical role with certain conditions. However, magnesium comes in different forms. There's a magnesium citrate, there's a magnesium carbonate, and there's a magnesium chelate. Well, the chelate is bound to a dipeptide, to two amino acids. And so it could get absorbed even in the absence of digestion through the gut and into the body. Whereas other magnesiums can cause a lot of upset, diarrhea, and not well absorbed. Um, folic acid, a lot of women are having to take folic acid when they're pregnant so they don't have a neurotubal defect. um, but a certain sect of the population could not absorb folic acid in a supplement. So there is a version called 5-methyl tetrahydrofolate. Um, it's a version of folic acid. Let's just call it folate. And it's significantly more expensive than folic acid, but it does the job so that every single person can utilize that and have it converted in the body. Another compound that I absolutely love is glutathione, and most of the glutathione on the market is reduced glutathione, and you want either an acetylated version or liposomal. So again, whoever you're working with really needs to understand the companies and what they use, how they manufacture, even the excipients that they use. So just it's the education and background that they have, a specialty that they also offer or have a little bit of that emotional health coach support, helping you get through this time. They're open to not just solely functional medicine and the compounds that they recommend, but they would never say don't take a drug. And that they specialize in certain areas. To me, those are really the important things to look at, because so many people ask me, well, what is a functional medicine practitioner? Um, why I believe functional medicine is becoming more well known and needed, and why that gentleman, that doctor said we're practicing medicine that's a century old, is our environment has really changed. The depression that we have today is very different than the depression we had 50 years ago. Because a lot of that depression that we're experiencing today has to do with inflammation of the brain and toxic overload. If you look down here at the bottom, how do toxins affect us? Um, Lack of energy, depression, right there. Inability to concentrate, anxiety, stress, all from toxic exposures. Microplastics are everywhere now, and they're infiltrating our brain tissue. We're getting microplastic in our brains right now, and there's nowhere left untouched. And this is according to The Guardian, which was just um, published last month in 2024. So this gentleman, Matthew Kempen from the University of New Mexico, there's much more plastic in our brains than I ever would have imagined or been comfortable with. That's scary to think. Um, Dark Waters was an incredible movie, and if you ever get a chance and haven't seen it, watch it. And it's all about these a couple that has this farm, and all of his cows have died, and they have, I mean, bloated organs, blackened teeth, these grotesque tumors. And then he and his wife get cancer, and come to find out, one of the leading chemical companies is dumping this chemical that creates Teflon into the waters, and it's called PFOA. And now 99.9% of the American population has a bit to some degree of PFOA in their bodies and microplastics. And then if you look just down here, where it says the EPA only tests, was it something like 200 of the 80,000 chemicals that are in production or in the market right now. And again, there are chemicals that are used and okay to use in the US that are not available or used in Europe. And so we're just getting a toxic exposure. And I think that's why there is an increase in mental health and mental health conditions, because I'm seeing patients now that are showing the um, effects of what would be a brain injury, and they're just having an incredible toxic overexposure. So it just is a fascinating time. It's an unfortunate time because we have uh, such greater toxic exposure. But that's why functional medicine has become uh, such an important part of medicine today, because we have to look at the root cause, and we have to take out some of these ingredients that are found in nature, and that we can put them in our body in a pill or a liquid form in a much greater amount than we would ever get from our food. There's an ingredient called sulforaphane that was discovered from broccoli, and it was the anti-cancer effect. You know, you probably heard the term, if you eat your broccoli, you won't get cancer. Well, Dr. Talalay at Johns Hopkins discovered that it was sulforaphane. So in a couple tablets, you can get the equivalent of 5 pounds of broccoli, but we need that now to fight this toxic exposure. My name is Scott. My company is My Brain Mechanic. I was primarily treating brain injuries and stroke victims, but I've started to get a lot more people come to me with mental health conditions, and I'm seeing autoimmune conditions in the brain that I didn't think were possible. And they're absolutely there. And in fact, I just did a video, and just about every single person that had tried to commit suicide had neuroinflammation in the brain and a leaky blood-brain barrier. So I will continue to bring out more videos. I really want to look at the gut-brain axis and talk about the gut a little bit more next time. Um, Pleasure to talk again and look forward to bringing some more video content to you.